Relax, Dad. What's wrong? Are you alright?
You.
Nurse?
You.
Nurse, can you come and help me,
You.
please?
Ron, what's
Look.
wrong?
Spiders.
This
There
is
are no
not
spiders.
normal for
There are no
him.
spiders, darling.
Spiders
Come on,
in the
have
bed.
a seat.
There is no
You've got to
spiders,
sit on the
Dad.
bed. Ron, there are no
Spiders.
spiders.
Is
You have
everything okay here? Ron, are you alright?
Spiders.
How does he normally mobilise?
He's pretty independent, and he walks by himself.
So-
But I'm really worried about him. This is not normal for him.
Okay, Ron, we're gonna put you in the chair if that's okay, away from the bed, okay? Just walk backwards with me. Here we go. And Jai Chi?
Yes.
So Jai Chi's one of our assistants in nursing, so she's going to stay with you and Ron while Vani and I step out and do some more assessments for your father-in-law. Is that okay?
Is everything alright with him?
It's probably likely that he's delirious, but we'll need to do some more tests. So in the meantime, Jai Chi will stay with you and Vani and I will just go and
Please
look at
do
his
something.
notes.
Thank you.
We won't be long.
Thank you.
Thank you, Jai Chi.
No worries. Hi, Ron. I'm Jackie. I'm the assistant nurse. I'm here. I will keep you safe.
Spiders.
This is Spider. You are here in the chair. It's safe. The spider won't come to you.
Hey, Chachi, can you
Yes.
tell me what's going on here?
Oh, your dad probably goes to the delirium. So the two nurses, they're going to discuss your dad's condition and then we'll come back for him.
So you think he's fine?
Yes, I will be here with him.
Are you sure?
Yes, I'm sure.
Oh, thank you.
Yes.
Vani, can you tell me what's been going on with Ron this morning?
Ron's been increasingly confused this morning. He'd come in with increased confusion. That was the reason for admission. He had liver resection and it's day 1 post-op, but he's more agitated and confused and he wants to get out of the bed and start walking.
And what's the reason why he came into hospital?
He's a heavy drinker and he also smokes few packets of cigarettes a day. So he'd come in with increased confusion, ended up in having a liver resection and it's day 1 post-operative for him.
Yeah, it sounds like he might actually be having a delirium. Have you ever done a 4AT assessment before?
No, I haven't.
So I can go through it with you now based on what I've just seen of Ron.
Okay.
So the 4AT has 4 sections. The first section is level of alertness. And would you say Ron has a normal level of alertness at the moment?
I don't think so. He's very hyper alert today, very agitated this morning.
So he scores a 4 there.
Yep.
And do you think Ron would be able to answer his age, date of birth, where he currently is in the current year?
I don't think he can this morning, no.
So he actually scores 2 on the mini cognitive screen. And for attention, which is the third section, do you think Ron would be able to state the months of the year out loud backwards, starting at December and going to January?
He's very inattentive this morning and I don't think he can do that.
Because he's so hypervigilant?
He is.
So he scores a 2 there. And the fourth section is an acute onset and fluctuating course. So you said he's quite different this morning to what he was yesterday. Is that
That's
correct?
Right. Yeah, that's right.
So he scores a 4 there. His total score is 12. Scores of 4 or more indicate a likely delirium. So it's very likely that Ron is experiencing a delirium. And with delirious patients, it's really important not to restrict their movement. This can exacerbate delirium. So it'd be really good to help you encourage Ron to stay out of bed during the day. We also now need to determine the underlying cause of Ron's delirium.
Yep.
Delirium is most of the time multifactorial. So for someone like Ron, we'll need to consider alcohol withdrawal. So we'll need to put him on an alcohol withdrawal scale.
Okay.
Nicotine withdrawal.
Yep.
So we'll need to get some nicotine replacement therapy charted. Pain, constipation,
Yep.
dehydration, malnutrition, and surgical site infection, and even electrolyte imbalance.
Okay.
So now we'll need to do a head-to-toe nursing assessment
Yep.
to help determine the underlying cause.
Okay.
Do you feel confident with that?
Yeah, I can do that. Thank you, Amy.
No worries.
Thank you.